Hi, everyone. It's Dr. Linder. In this lecture, we're going to be focusing on the kidneys and the urinary system and the nephron. And the way I like to open up the urinary system is to kind of discuss the big idea, right? How do the kidneys or the urinary system correlate and connect with the other systems? And this illustration does a really nice job at doing just that. So let's take a look at the connection between the urinary system and the integumentary system, right? When we think integument, we're thinking skin, hair, nails, but really focusing primarily on the skin. And the kidneys and the skin both contribute to the synthesis of calcitriol. What's calcitriol? It's the bioavailable or active form of vitamin D. When you go and get your blood checked for vitamin D, what we're checking is what's called the 25 hydroxide, OH, 25 OH. And you should get your blood checked for vitamin D at least twice a year, right? The summer months and the winter months, so we know how to moderate the supplementation of vitamin D3. And if you are supplementing vitamin D3, it should and must have vitamin K in the formulation. Vitamin D allows you to absorb calcium, and we have now calcium in our vasculature, in our blood vessels flowing around. And vitamin K is needed to drive that calcium into the tissue, right? Into the bone, the reservoir where it needs to be. If we don't have vitamin K in that vitamin D formulation, you can get what's called vascular calcification, where the blood vessels harden and blood pressure goes up. So we need the skin, where UVA rays come down at a 90-degree angle and hit the subcutaneous cholesterol on your skin. That happens, at least in the Northeast, from mid-September to mid-May. It does not happen. That's where supplementation is needed. But from about mid-May to mid-September, it does. So you got May, June, July, August, and a few weeks of September at best. So the subcutaneous the UVA rays come and hit the subcutaneous cholesterol on the skin. You make these vitamin D precursors. And then it goes through circulation, goes to the liver, where it gets hydroxylated, and then it goes to the kidneys. And the kidneys make the active form of vitamin D. So there's a lot of variables. You need direct sunlight, good skin, good cholesterol, healthy liver, and good kidneys. Let's look at the skeletal system. And the kidneys help to adjust the level of blood calcium and phosphate needed to build the extracellular matrix of bone. Calcium makes up a certain percentage of the bone. Collagen makes up about a third of the bone. So the ECM, the extracellular matrix, we need kidneys to help adjust the level of blood calcium levels, because the distal convoluted tubules, and I'll get into what exactly that is, I'll draw it out in another video, but the distal convoluted tubules is where PTH, or the parathyroid hormone, it's where parathyroid hormone affects the nephron at the distal convoluted tubules. And that allows the body to modulate the amount of calcium in blood, right? If there's too much calcium in the blood, the thyroid makes calcitonin and it gets that out of the blood and drives it in the bone. But if there's not enough, PTH takes it out of the bone and brings it into circulation, keeps it in balance. The muscular system, the kidneys help adjust the level of blood calcium needed for muscles to contract. So if you think back to AMP1, when we covered the muscular system and we did muscle physiology, or we spoke about the neuromuscular junction, where the nerve and the muscle meet, the end of the axon, where you have the end bulbs, the synaptic end bulbs, contain the neurotransmitter acetylcholine, ACH. And ACH is in this vessel that needs to move to the end of the axon terminal, and through exocytosis, it opens up and releases the acetylcholine into the synaptic cleft, where it binds to the motor end plate of the muscle, and it binds to that sodium channel that needs to open for sodium to rush in. Calcium is needed to signal the vesicle to open up and release the acetylcholine. So calcium is needed for like nerve conduction, muscle function. It's even needed for clotting, and it's a cofactor in so many different reactions. How does it affect the neural system? The kidneys perform gluconeogenesis, which is making new forms of glucose from non-sugar forms. And it provides glucose for ATP production in the neuron, especially during fasting, right? If you're in a fasting state and you're not eating, or intermittent fasting, the brain needs to work. You still need ATP, you still need energy. So the kidneys are involved in gluconeogenesis. The endocrine system, the kidneys participate in the synthesis of calcitriol. Again, that is the active form of vitamin D. And what else? The kidneys release erythropoietin, which we can abbreviate as EPO, erythropoietin. And that's the hormone that stimulates, it goes to the bone marrow and produces more red blood cells. So if the nephron, if the part of the nephron, again, that's the functional unit of the kidney where we have the glomerulus, the Bowman's capsule, the proximal and distal convoluted tubules, and loop of Henle, all which I will draw out for you in a separate video on a slide. There's a certain part that's referred to as the juxtaglomerular complex that has a lot of chemoreceptors and mechanoreceptors. If they detect that blood oxygen levels are too low, then it needs more oxygen. EPO goes to the bone marrow, pushes out more red blood cells. So you have these red blood cells that have hemoglobin, and hemoglobin is heme and globin, which is iron attached to a protein carrier called a globular protein, globin. And it allows, you have more structures, more cells that have the potential of binding to oxygen to help oxygenate the tissues better. The cardiovascular system, by increasing and decreasing the reabsorption of water that's filtered from both, from the blood and the kidneys, to help adjust the volume of blood. So if you remember back, and if not, we'll draw it out in a separate video, the RAS system, which is the Renin, Angiotensin, Aldosterone system. We have the liver, and you have the kidneys, and you have the lungs, all involved in regulating blood pressure. Renin is released by the juxtaglomerular cells in the kidneys. That raises your blood pressure. And again, I'll draw that out for you so you have a stronger understanding of that. And I want you to be able to draw it out as well. Some bilirubin from hemoglobin breaks down. It's converted to that yellow pigment urobilin, and that's what gives urine its color. The lymphatic system, by increasing and decreasing the reabsorption of water filtered from the blood and the kidneys, help to adjust the volume of the interstitial fluid and lymph. And urine helps to flush out any of the waste or the microbes out into the urethra. The respiratory system, the kidneys and the lungs cooperate in adjusting the pH, right? Potential hydrogen. So the body, the lungs can get rid of, carbon dioxide, which affects your pH. Through the urine, we can get rid of hydrogen. And right, the more hydrogen, the more acidic, the less hydrogen, the less acidic. We'll talk about pH of urine, and keeping the pH of urine somewhere around 7.2 is really important for detoxification. Most patients that I check, their urine is somewhere around 5.5, somewhere around there. So it's on the acidic side, but specifically for detoxification and flushing out debris from the body, We'd like to see the urine somewhere around that 7.2 pH. It works in conjunction with the liver for detoxification. The digestive system, the kidneys help synthesize calcitriol, which we know is the active form of vitamin D, and that's needed to help us absorb calcium from the GI tract, from the gastrointestinal tract. And the reproductive system in males, portion of the urethra that extends through the prostate and the penis is also the passageway for semen and sperm, not just urine. Okay.